Hypertension is a silent killer because it hardly produces any symptoms. And more often than not, when it eventually produces a symptom, maybe like headaches or dizziness, it had already damaged vital organs in the body, like the kidneys, the heart, etc. You are welcome once again to the channel, Dr. Ayo Cares. I'm Dr. Ayobola Ogunbanjo, and today we shall be talking about hypertension, some of the risk factors, the causes, and the classification based on American Heart Association. Before then, kindly subscribe, like, and share this video to reach more people so that a lot more people will benefit from this. So let's get to it. What is hypertension? Hypertension is when the pressure coming from the blood, the force of the blood, is too much against the walls of the artery. So the pressure from the blood is eating too hard against the walls of your arteries. So this is how the American Heart Association classify hypertension based on stages. Normal blood pressure is systolic of 120 millimeters of mercury and diastolic of less than 80 millimeters of mercury. And then the elevated blood pressure is systolic of 120 to 129 millimeters of mercury and diastolic of less than 80 millimeters of mercury. Then we have the stage 1 hypertension, where the systolic blood pressure is between 130 to 139 millimeters of mercury and the diastolic is 80 to 89 millimeters of mercury. Then there is the stage 2 hypertension, where the systolic blood pressure is 140 millimeters of mercury or more and the diastolic is 90 millimeters of mercury or more. Sometimes around here, we take 120 over 80 millimeters of mercury as a normal blood pressure. Then let's talk about etiology of hypertension. In medicine, when we say etiology, we mean causes. So hypertension based on etiology could be primary or secondary. Primary hypertension is known as idiopathic hypertension. That is, it doesn't have any known or identifiable causes. And then we have the secondary hypertension. This kind of hypertension occurs as a result of certain underlying medical conditions like complications of diabetes, where we have the diabetes nephropathy, like certain endocrine problems with the pituitary gland, adrenal gland. It could be problems with the thyroid gland. And then it could be due to drug abuse, like when you use cocaine. It could also be due to coarctation of the aorta, pregnancy, certain medications and supplements, to mention a few. Don't forget, the primary cause is often unknown, and the secondary cause are due to some of these diseases I mentioned to you. Now, what are the risk factors for hypertension? We classify these risk factors as modifiable risk factors and non-modifiable risk factors. The non-modifiable risk factors are the ones that cannot be changed. You don't have control over it. And they include, number 1, age. Being older is a risk factor to have high blood pressure, like being 65 years old or more. Number 2, your sex. Being assigned male at birth is a risk factor for hypertension. Number 3, your race. Being black is also a risk factor for hypertension. Number 4, your family history of hypertension and genetics. If you have a mother, a father, or a sister who had hypertension, you could also be predisposed to having the same. And now let's talk about the modifiable risk factors. These are the ones that are within your own control. Number 1, obesity. Being overweight is a risk factor for having hypertension. Number 2, inactivity, having a sedentary lifestyle. Maybe you're in the office, you sit all day, or you don't have time to move around throughout the day. Number 3, excessive alcohol consumption is another risk factor. Number 4, excessive salt consumption. Sodium could cause water retention in the body, leading to hypertension. Number 5, drug abuse, like certain drugs like cocaine and are risk factors for hypertension. Number 6, eating a lot of fatty foods, junk foods, and the rest. Number 7, taking a lot of sugars, carbonated drinks, sodas, and all of that. Those could contribute to obesity and then increase your chances of having hypertension. I think we stop here for today. I hope you have been able to learn something about hypertension. Watch out for the next video where I'll be talking about how to prevent hypertension by modifying some of these risk factors, the management of hypertension, and also I'll be mentioning one of the classification of hypertension I forgot to mention in this video, hypertensive crisis. Till then, don't forget to subscribe, like, and share this video to reach more people. Always know that Dr. Ayo truly cares about you. Bye.